Good evening from here. My name is Adaeze Oguegbu. I'm an online lecturer in the Master of Public Health program at the Mel and Adaeze Zuckerman College of Public Health at the University of Arizona. I am very privileged to give this lecture today, and then I will go into sharing my slides. So the topic for today is planning and evaluating HIV counseling and testing promotion program. Basically, we are looking at how we can plan and evaluate a public health program, be it a prevention program or a promotion program. And as I introduce myself, I'm a lecturer in the Online MPH program. A little bit about the University of Arizona land acknowledgement. We acknowledge here at the U of A that we are on the land and territories of indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to Odam and Yaqui. We are committed to diversity and inclusion here at the university, and we strive to build sustainable relationships with sovereign native nations and indigenous communities through education offerings, partnerships, and community centers. So you are highly welcome to the lecture, and I will give a brief overview of my biography. I have a PhD in public health, emphasis in community health education. I have a master's in public health degree, a Master of Science degree in health education, a Master of Science degree in human nutrition, and a Bachelor of Science degree in education. I will try to speak slowly and legibly, that way you can all follow with the lecture. So let's begin with how we can evaluate a program. Before we go into evaluation or planning, we look at how to define that health problem. So in this case, for the project I did, I specifically picked young people and adults between the ages of 59 to 49 years old. So the study was to see how this particular age group can receive and accept HIV counseling and testing services in Nigeria. Defining the problem, prevalence has been at an all-time high, from statistics given UNAIDS to the National Agency for Control of AIDS. There are about 1.9 million people that are living with HIV in Nigeria. Also, a new data differentiates HIV prevalence by different states, indicating an epidemic that is having a greater impact in certain areas of the country. So if you're looking at that breakdown of the statistics, you can see that there are different data and information coming out from the different zones and areas within the country. And we shall look into this as we progress throughout the lecture. Also, studying the problem, the rise in HIV prevalence among this group of people can easily be attributed in part to the factors that are associated with HIV counseling and testing uptake. These services are available, for people to use. However, there are some deterrences or some things that limit people from being able to access some of these counseling and testing services. Based on research, it's established that young people within this age, 15 to 24, are the most susceptible to HIV. They are very prone to HIV basically because of their age, gender, marital status, the socio-economic status, some of them practice unhealthy sexual risk behaviors, and they don't even know about HCT, that it exists at all. It's important, to obtain prompt and fast diagnosis of HIV infection. It's vital, when we're looking at prevention and management of these epidemics. So we will use this HCT model to give an example of how we can evaluate a public health program within the country. So bearing that in mind, when I worked on this project, I emphasized the use of the socio-cognitive theory. I use this cognitive theory because it emphasized basically how people can attain and sustain behavioral patterns, while also providing a focal point for intervention strategies. Some of the predictions I made were, like I mentioned in the previous slide, socio-demographic or environmental factors, their level of education. Some of these people are not very well educated and may not understand the importance of HIV counseling and testing. Some of the places they live are not accessible to these services. Those that live in very rural areas have issues with transportation, they have issues with accessibility, to some of these areas where they can obtain HIV counseling and testing. Religion also plays a role in addition to marital status, and we're going to look at some of these as we go through the slides. The cognitive factors that come in play here are awareness that HIV counseling and testing actually exists, knowledge of how to prevent HIV and infection and transmission. So some of these issues were brought together as I considered how we can roll out this program, and evaluate the effectiveness of this program at the end of it all. So I put up a schematic to just show you a pictorial view of some of the factors that I considered during this project. Using the social cognitive theory by Bandura, you can see there the behavioral factors are basically the uptake of HCT among young people. Now, when I break it down to personal factors and social demographic factors, the personal factors include cognitive and affective. And within cognitive and affective is where we see knowledge of prevention, which some people don't have. They don't have a knowledge of HIV transmission, how we can be transmitted from one person to the other. Some of these young people practice engage in multiple sex partners, intergeneration sex, or even transactional sex. So some of these cognitive and affective behaviors are the personal factors that come into play when young people are exposed and are eligible to some of these issues with HIV. On the other hand of the map, there is also the social demographic factors or the environmental factors that come into play, when you want to actually bring out a program in a society, which are geopolitical zone, like I mentioned a little bit in the previous slide, where they live, they may not have access to some of these amenities. The educational status is another issue, sex and religion, and of course, socioeconomic status. Some of these people in the rural areas just have enough money to feed. Some cannot even make 3 meals a day or 2 meals a day. So it's a problem incorporating something else outside of basic needs of a society, of a community. So now let us relate how we can apply evaluation using program theory to evaluate a program. And I began with this HCT model to show you, give you an example that I will always go back to as we go through this lecture today. And of course, the rest of the slides will show you generally how you can evaluate a public health program throughout the planning process, implementation process, and all through to dissemination of your information. So looking at that schematic, there are two types of theories that we're looking at today in relation to evaluation and evaluating a public health program. The first one will be the program theory. So here we break it down into process theory and effects theory. Within the process here, we're looking at an organizational plan. So what exactly in the organization will we need to be able to evaluate a program? For example, the workers, the personnel within that organization, do they have enough furniture? Do they have enough things that can be used in order to complete this evaluation? And the effect theory deals with the activities or the interventions, what exactly can be used, during that evaluation in order to achieve the product outcomes and the outputs. And this next slide also gives you a more in-depth explanation of process theory components. So if you remember from the schematic, there's the organizational plan. And within this organizational plan, what we focus on is the personnel. So who exactly is available within the organization to help to complete this evaluation plan? Does the organization have the resources that they need? If we need money, or if we need papers, if we need pens, if we need basic office requirements, it's important to determine that all these resources are available and attainable by the organization. And they also have the capacity. So not just the personnel, you could have a number of people within an organization, but you may not have people that are specialized and qualified for specific activities. So it's important before you begin any evaluation process, make sure that the organizational plan is well established, with the personnel, the organizational resources, and the capacity. Now, while you're still considering the process theory components, you think about the service utilization plan. Within the service utilization plan is how you reach your target audience and deliver this intervention. So in this case, I have an established target audience, which is young people between 15 to 24 years. And how do we deliver this intervention? Will it be in a classroom setting, in a town hall setting? Will it be something that will be carried out in homes of individuals? So these are some of the things that you consider depending on the program that you want to evaluate. The effect theory components will include the causal theory, which explains the factors that are involved in the evaluation. So looking at the causal, you have to go back to the health problem that you're trying to evaluate. What actually causes this health problem? What is the main cause? Is it because people are not informed about HIV prevalence? Is it because people don't know there are services out there for them to obtain counseling and testing? So these are some of the things that you evaluate under causal theory. And intervention theory explains what the intervention will change. So in this case, I am looking to increase the number of people or the number of these young people that access HIV counseling and testing services within an area. And I will cover that within the intervention theory. And the impact theory here will look at how the short-term goals or outputs can turn into our long-term goals or outputs. So whatever we want to achieve in the short term, is it practical? Is it sustainable? And is it something that we can actually carry on over a long period of time? So in talking about evaluation, there are types of evaluation that we'll look at today. Let's just get a brief overview of some of them, 4 of them actually. The first one is the formative evaluation. So when you think about formative evaluation, it's basically conducted when a new program or activity is being developed, or when you have an existing one and want to adapt or modify that particular evaluation. So formative, from the name, is simply something that is new, and about to be conducted. The process or implementation evaluation determines whether program activities have been implemented as intended. So we're looking at how this program was supposed to be implemented, all the steps involved in implementation, and were they actually implemented the way they were supposed to be implemented. So that's what we cover in process implementation evaluation. And the outcome measures program effects in the target population. This outcome evaluation does this by assessing the progress in the outcome or outcome objectives that the program wants to achieve. And the impact looks at achieving the ultimate goal of the program. Has this program met the ultimate goal? Does the program effectiveness actually address all the initial goal and objectives of the program? So these 4 types of evaluations are important to have in mind whenever you're trying to evaluate a public health program, or even implementing the process of implementing or planning a public health program. And then I provided this schematic to kind of break down the different evaluation types and shed more light on the differences, between these evaluation types, when you can actually use them, what it's designed to show, and why it is needful or why it's useful. So from the formative evaluation, remember we said that when we use those is when we are developing a brand new program. So if you, for example, have a new program that you want to begin, the formative evaluation will be a good place to actually investigate. And here is where you have needs assessment. You have to determine if this is actually a problem within the community. Is this a health problem? Identify the health problem and make sure that you justify that health problem as it relates to the target population that you want to reach. Also, the formative evaluation can be used when you have an already existing program and then you want to make some changes, which can be minor changes or complete modification of the program. The formative evaluation shows whether these elements that are needed are accepted by the population you want to reach. And that is why it's very important at this phase to consider the needs assessment. And within the needs assessment, you can also use the target audience, to determine what these needs are. That way you have a more focused plan for both implementation and evaluation. Formative evaluation is useful for modification, usually made to plan before the full implementation begins. And it's very important for formative evaluation because it helps to maximize the likelihood that a particular program will succeed. Now, right below the formative evaluation, we have the process evaluation, or what we call the program monitoring. So you can see that as the implementation phase when activities are actually being implemented, and is used for operation of an existing program and during the implementation phase, like I said. And what it shows is how well that program is working. So if you're doing a process evaluation or a program monitoring, the main goal is to ascertain if that program is working as planned in the initial phase. It's also used to show the extent to which the program being implemented was done as designed, and if that program is accessible to the target population you want to reach. It's useful to conduct a process evaluation because it provides an early warning for any problems that may occur. So within the implementation phase, doing this process evaluation helps you to identify problems promptly and address those problems as they arise. And then it allows programs to monitor how well their program plans and activities are working. The outcome evaluations are basically objectives evaluation. So these ones focus on the objectives of the program. And this happens after the program has made contact with at least one person or group in the target population. So the program would have at least gone through the whole process for either a person or a whole target population. And it shows the degree to which the program is having an effect on the population's behavior. So here we are determining if there is an actual change in behavior before this intervention and during the intervention. And then finally, the impact evaluation. During this phase is when you look at an existing program and make sure that it's appropriate at different intervals, especially done at the end of the program. It shows the degree to which the program meets the ultimate goal. So for example, using the HCT model, which is a HIV counseling and testing program, at this impact evaluation level, we want to see how much of these participants or the program target audience actually access HIV counseling and testing services. Was there a decrease prior to this program, or did we increase the number of participation in HIV counseling and testing? The important part for the impact evaluation is that it provides evidence for use in policy and funding decisions. So for each of these steps, you can see that the evaluation types all have different uses. They all have different components that shows from them, and it shows different reasons why they are useful. And every single step of the evaluation type is useful, when you're looking at evaluating of a particular program. Now we'll look at the steps that are involved in public health program evaluation. This is very interesting, as I'm also going to make reference back to the HIV counseling and testing intervention program. So the first thing to consider is to engage stakeholders. And you ask yourself, who are these stakeholders? Who could they be? A range of people that can be, university partners, community workers, some non-governmental organizations, leaders in the communities, some schools that have invested interest in that health program and want that particular health program to succeed. When you identify and you engage those stakeholders, you will describe the program. How exactly are you going to carry out this program evaluation? You will look at the evaluation design that you decided to choose, and then use that evaluation design in such a way that it is simple and can be presented to an audience in a very smooth and simple manner. Then it's important to remember that you will gather credible evidence. There will not be a successful evaluation without credible evidence. So you need that evidence either through primary sources, which we are going to look at in the next slide, or secondary sources. And then after this credible evidence is gathered, you will justify the conclusion, saying this is what I attained as a result of using this evaluation design, gathering credible evidence, describing the program. This is the justification that I am achieving from this evaluation. And the final step, very important step, is ensuring that you will use and share the lessons that you learned as a result of this program evaluation. And let's look at these steps again. I know I went through them a little bit. We'll look more in depth into what some of these steps entail. So the stakeholders are basically anybody, that have something to gain or lose from what will be learned from this evaluation. You can identify your stakeholders in various ways. They can include clients. Some of them could be family members, neighborhood organizations. They could be sponsors, people that want to fund the program or are interested in funding the program. Others can be collaborators that are willing to work with you, probably colleagues, people that share common interests, that have the same ideas. Funding officials, academic institutions. And then you can also go further when you're looking at stakeholders, consider elected and appointed officials, even advocacy groups and people. The target audience themselves are people that live within the community, or the community residents. So after the identification of the stakeholders, you will describe the program. It's important for them to understand what the program is, what this program is actually trying to achieve, and how it can bring about the desired changes. The program description will illustrate the core components and elements of that program. It should also include the ability to make changes, because basically every public health program, as you go through the implementation phase, you will see the need to make changes and updates. So it's important, as you describe the program, remember to incorporate avenues for making changes. Then the description will also allow members of the group to compare the group to other similar efforts. So probably there might be some other things that have been tried in the past, other programs that have been tried in the past that relates to your own program. However, making that distinct description of your program will help to actually make them understand why it's better and why your own program is needed for evaluation. Remember that when you're choosing stakeholders, they have different ideas about what a program is supposed to achieve and why. So for example, for the HIV counseling and testing program, I used or collaborated with medical personnel within the medical field. I also had people from youth advocacy groups. All these different stakeholders had different views. From the medical perspective, they had a different view of what they thought, this program should achieve. And the youth advocacy groups also had what they wanted to achieve, from this program. However, it's important as you describe this program to make sure that they all understand the common goal that you want to achieve. Make sure that you're focusing on what you want to achieve, the objectives and the outcomes of your program. Now, you will focus on the evaluation design. Why you focus on the evaluation design is important to plan in advance, where this evaluation is going. Not just where it's going, what steps exactly do you need to take in order to get to the end of the evaluation. If you have a very well-focused plan, you will prevent using time and resources inefficiently. So a good and focused plan helps you to channel your resources effectively and manage your time effectively. A detailed plan will anticipate or include the intended uses, create an evaluation strategy with the greatest chance to be useful, feasible, proper, and accurate. So when you're designing this plan, don't just look at a plan that is very sophisticated. Focus more, on the strategy that you can apply that will be useful, that will be accurate, and be easy to actually implement. Remember also that when you're focusing on the evaluation design, once you begin data collection, it may be difficult, or it may even be impossible to change what you're doing. So it's very important to look at the different design and choose the particular one that is suited for your health issue or for the program that you want to implement and evaluate. Now, you will justify conclusions. This is very important within the evaluation process. These conclusions become justified when they are linked to the evidence gathered and judged against agreed upon values that are set by the stakeholders. So these stakeholders must agree that conclusions are justified in order to use the evaluation results with confidence. So in order for you to get the stakeholders on board to agree for your evaluation to be used, your evidence must be carefully considered from a number of different stakeholder perspectives. So if you're working with universities, for example, professors, and you're working with youth advocacy groups, it's important to make sure that you incorporate them, look at their perspectives in order to be able to come up with a justifiable conclusion. And this justifiable conclusion includes different possible steps. For example, it can be strengthened by searching for an alternative explanations from the one you have chosen. So when there are different but equally well-supported conclusions, you can be presented with a summary of their strengths and weaknesses. So that's another way to get different stakeholders on board, when you're trying to evaluate a program. When you look at the various strengths and weaknesses, they will be able to understand, look at the general picture and determine if the strengths are greater than the weaknesses, or if the weaknesses are greater than the strengths, and how they want to be involved in the evaluation process. So the next slide is sampling steps and realities. What steps are involved in sampling? We remember at the beginning of the presentation, I talked about choosing my target audience and the sample that I used. So the first step is to identify the program participants and the target population. This is where some research, prior research comes in, to identify who will benefit from this program, who will be the best group of people to target. When this is identified, you go on to develop a plan to help you select an unbiased sample from every group. Some limitations are involved in sampling steps. Some of them could be that the number of people that can participate in the program may not be that much, they may not be willing. And then sometimes you can't always distinguish participants from non-participants, and those that are eligible from those that are eligible for the evaluation and for the implementation of the program. However, when you want to sample for outcome assessment and evaluation, outcome assessment basically relies on non-probability samples. These are strategies that are generally easy to implement and explain to stakeholders. So that's another good assessment that can be used when you're trying to convince stakeholders and to get them on board with your evaluation process. The outcome evaluation relies on probability samples. The advantage of the outcome evaluation is that it increases external validity. It can also generally cost increases as it becomes more complex within the outcome evaluation. And then data collection methods could be primary or secondary, how you intend to collect data for this program and for the evaluation. Sometimes people prefer primary depending on the geographical area you're using, the availability of already existing data. So most of what we did for the HIV counseling and testing was from rural areas. We did not have a comprehensive data, for existing data. So we had to do primary data collection, which involved generating new data, going out to source for questionnaires, interviews, focus groups in order to collect and generate new data. Some other programs are easily accessible that have existing data, that's called the secondary data collection, where you can access data from different sources within the community. Some of the sources for secondary data collection can be vital records. These vital records are obtainable from disease registries like death certificates, birth certificates. You can also obtain data resources or sources from national surveys. For example, in the US, we have the American Community Survey, the National Health and Nutrition Examination Survey, and so many others. In Nigeria, we have the National Health Administration and Nutrition Survey. So depending on what you have available, secondary data source can also be used as a source. National surveys can be used as a source for national secondary data collection. Then there's something else different that is called the combined data, where you have area health resource files or opportunity indexes that can be found in some of the government offices or local government offices. Physical data can also be collected as part of the primary data collection. So depending on the actual program, the health issue that you want to address, this can include biological samples, blood, urine, hair, anthropometric measures. In this case, I had to use anthropometric measures to determine height, weight, and body mass index for some of the participants. You can also choose to collect data based on environmental samples like ozone levels or bacteria counts within the environment. So these are just some of the examples that can be used as physical data sources for program evaluation. The individual in-depth interviews can be used throughout the planning and evaluation cycle. And this was part of very good use for us in evaluating our HIV counseling and testing program. The key informats, especially useful in assessment and planning. So when you're thinking about individual in-depth interviews, you will think of who exactly you will be using for the interview. This can be key informats that range from maybe community leaders, the heads of households and families. Some of them can be youth group leaders, and even tribal leaders, depending on the area that you're trying to assess. So in our case, we had a king who is like the leader of the community, the king of the community. His cabinet members also served as key informats for providing useful information. And you can focus on meanings and attributions and make sure that you look at the skills for interviewing. Interviewer skills are critical. If you do not have the right skills to interview, you will not get the right results or the responses that are needed. So these skills are important when you're interviewing, making sure that the environment is comfortable, conducive. The interviewees are also free and comfortable to respond. The questions are clear, as you're interviewing. Make sure that you don't use bogus words or confusing words. And also, if you need to interpret or translate, that the translator has been trained and can properly translate information for those that are being interviewed. Another good method of gathering data and information for evaluation are focus groups. I know you probably have come across focus groups or maybe prior classes. They are very good and they can be used during assessments and program planning. So not just for evaluation, they are very good for assessments and program planning, and even monitoring the process, while you're implementing your program. The group dynamics during the interview may produce new insights. So sometimes when you do an individual interview, you may get different responses when you conduct a group interview or a focus group dynamic. You get people with different ideas, brainstorming and giving you insights for the program assessments and the monitoring and the evaluation. The focus group also has the same data analysis steps for individual and the in-depth interviews. So they all go through the same data analysis. And when you're collecting data for focus group interviews, the ideal number of participants should be about 8 to 12. I say 8 to 12 in order to help you manage the group. If you go for too many people, you may not be able to moderate effectively. Discussions may veer off points. So the number is important for you to maintain that discussion and make sure that you're on the right track for the focus group interviews. You also balance different things. We have different groups of the participants. We look at the age. You don't want to have just a particular age, just children or the adolescents or the adults. It would be good to have different groups, ages represented, within that focus group. Another problem with the focus group is that the scheduling can be challenging, especially when you want to balance homogeneity with heterogeneity, different groups of people having different timelines. It could be challenging, but it's encouraged, to limit it within a particular number and try to get different groups as possible to represent that focus group. And as an interviewer, one of the skills that you must have is to make sure that everybody is participating in the focus group. There's always this tendency that some people are quiet and withdrawn, and at the end of the focus group data collection, you don't hear anything from them. Those quiet ones may be the ones that will give you ideas that will be very useful. So try to elicit response from everybody, not just those that are talking or those that are willing to talk. Also try to elicit responses from the quiet participants or those that are withdrawn or not very willing to speak. And that's why we mentioned in the previous slide that as an interviewer, you need the skills. You have to be skilled, making sure that everybody is comfortable and everybody feel it's a safe place to contribute and to be heard. That's a very important attribute for the interviewer. And of course, for some of the quiet participants, maybe a translator may be needed. Remember that the translator has to be trained to make sure that whatever content they are translating is exactly what you are trying to convey to the audience. If you're recording, it has to be unobtrusive. You can use maybe audio recording, or you can use handwritten notes. So when I say unobtrusive, some people may not be comfortable with video being on a camera. So most people prefer, being recorded audio, or even, when you're writing down their responses, they could be much more comfortable with that. So these are some of the ideas or things to consider if you want to do a focus group data collection to help you with a program evaluation. Now, the point of program evaluation is that we're going to present findings. We cannot complete an evaluation without presenting these findings. And within presenting findings, it's important to make sure that the components are visible. That way you are sure you are actually communicating and you're reaching your target audience and your stakeholders and any other person involved or invested in that particular evaluation. So for your findings, you will make sure that there is transferability. Describe the data collection context. Make sure that they understand, how was the data collected? Is it primary? Did you actually go out to do focus groups? Did you do interviews? Did you collect specimens? Did you collect anthropometric measurements? So these are examples of how you can present your findings. Also, these findings have to be dependable and have confirmation. So make sure that the information is there to back up that you have a dependable source and they can confirm it, which includes the participants' words to humanize findings. So the confirmation part of this can include excerpts that you get from the participants during the focus group or during the individual interviews. You can diagram relationships among categories. That will help you also when you're presenting the findings. Looking at these diagrams will provide much more detailed information for the stakeholders and whoever that is invested in the evaluation. You can also relate findings to program theory or logic model if possible. Remember, we began with the program theory, the process theory. Make sure that you go back and relate your findings to the theory that you began with. Or if you're more comfortable using a logic model, that is also good. That can be used to relate the findings of your program evaluation. Another aspect that is important, within evaluation is what we call the 8 elements of informed consent. So this is where we look at initially, before we even begin to collect data, before we begin to interview people, before we begin to think about focus groups, we look at the elements of the informed consent. And that states that research and participation is voluntary. So whoever you're using or whoever you want to participate, make sure that you explain that it is completely voluntary and not mandatory. You will explain the research purpose so people can understand what they are going into. Why is this research needed? It's also important to describe the procedures. So the types of data, if you're going to be collecting a specimen from people, you have to actually discuss that prior to the actual collection. Possible risk or discomfort can also be discussed. Let them know if there is any risk or if there is any discomfort that are associated with this particular process. And if they have any benefits, that will also be good to explain. Tell them exactly what they have, if it's a direct benefit or if it's an indirect benefit. That way it helps them to make up their mind to participate in the program. Statements of confidentiality must be drafted where you state exactly how you intend to disseminate the information you're going to obtain from this target audience, which can include, of course, that it's anonymous. If it's how you want to go about that, they need to understand. People feel more comfortable if they understand the level of confidentiality that is going into an informed process of consent for a program. Then you will describe compensation for the participants. Are they going to get paid by money, or are they going to be paid some another way? They need to understand what the compensation for participating. And finally, the contact information about the study, the rights of the participants, and then if they need any assistance, if there's a problem resulting from participation, they need to know who to contact and make sure that whoever is the contact person is available, well informed and educated to answer any questions that arise throughout the evaluation process or the program process. Now, you will make recommendations, based on the data that you collected during the process. The recommendation is important to link to organizational and service utilization plans. So you will always go back to your program theory and make sure that these recommendations are linked So if within your program theory, you emphasize that you are using a personnel within the organization, you will link back to that to make sure that you're stating exactly how the personnel are expected to act, what they will do in order for this program to be successful, or what they need to continue to do in order to make sure that the program is sustainable over time. You will also collect ideas throughout planning, implementation, and evaluation. So as you're planning, you're collecting more ideas. When you involve stakeholders, you involve focus groups, key people, you are actually getting ideas. And these ideas can be changed, modified, updated throughout this process. Remember to include outside sources as justification. So when we talk about outside sources, basically, you're looking at peer-reviewed articles that are related to that problem, research that has been done in the past, what the current literature is saying in order to support your recommendation. Also link your recommendation to larger social, political, organizational context. So you want to apply it to something like policy, at the government level. What recommendations will you link to public policy that will make social change and bring about some changes in advocacy? And finally, it's important to make them easy to understand. Throughout this process, I've talked about making things easy, simple to understand. Try to avoid bogus words, confusing terms. When you're making recommendations, stakeholders, interested parties, funders, they want to see what you are recommending. They want to look at it and make sure that they understand it, and they don't want to think too much to understand it really. So it's important to make sure that it's easy to understand where you're making your recommendations. And then, of course, every evaluation should end with a responsible dissemination of information. So the goal of a good evaluation, program evaluation, is not just to achieve the aim or just to make sure that the program is successful. It's important to disseminate the results and information. So responsible dissemination here can be in the form of reports that are made available beyond the stakeholders. So beyond the stakeholders are not just those that are available within the stakeholders. This can be people that are not even listed as stakeholders that may in the future become interested in the program. You can also publish on academic journals. Also, you may need to negotiate with stakeholders upfront. When you're talking about dissemination, are you going to be the primary author? With some of the stakeholders, are they going to be interested in partnering in authorship? So these are some of the issues that you consider. And also potential conflict of interest if published evaluation was conducted by program developer. So make sure that there is no conflict of interest when you're disseminating the results of this evaluation. I provided some additional resources for reading. If you're interested in more reading about evaluation, how you can implement, plan, evaluate a public health program. I also included links to the publication for my projects for the HIV counseling and testing, where we investigated the relationship between social demographic factors and acceptance of HIV counseling and testing. There's also another link there on the relationship between the awareness of HCT and the uptake. So here I looked at how we compared how young people that know about HCT actually go out to obtain the services. And there are also some other publications, recent publications that are also useful if you want to study more on program evaluation, evaluating, planning, implementing, and disseminating evaluation information. Thank you so much for taking the time to go through this lecture with me. Sorry I couldn't be there. Maybe one of these days we'll meet in person. If you have any questions or concerns, you are more than free to email me. I included my contact email, aoguegbu@arizona.edu. Thank you very much for listening.